Today we will demonstrate a peeling from Cerefarma based on glycolic acid. It is a superficial peeling, the GLYC-EXFO. You have it in three concentrations. You have the 20%, you have the 35% and the 50%. It is a superficial peeling based on glycolic acid. It comes in 4 vials of 6.5 ml, and with one vial normally you can expect to do 3 to 4 sessions. You will apply the peeling with the cotton swab, what makes it really easy and there is no problem of drops. What will we need for the peeling? The first step is cleansing of the skin, so you use the gentle makeup remover of Contrage to clean the skin. We use it for lukewarm water, and normally we use small towels for this cleansing. After the cleansing, you dry the skin, you apply a pre-peel, and you prepare the patient with some cream to protect the more delicate zones like the contour of the nose, the lip contour, or some places that would show some irritation. You can use therefore our crème confort from Contrage. That is like a barrier cream and a protection cream. The eyes of the patients will be protected by cotton pads that we will make a little bit wet to remain in place, and the peeling can be applied with, like I told, the cotton swab. After the peeling we will neutralize it with the peel neutralizer of Contrage, and we propose to rinse the skin twice with cold water post-peeling to give a recomforting effect to the skin. So before starting also any peeling or first session, you take photographs of your patient, you take them straight, 3/4 and profile, and this from both sides. This will give you the possibility to compare the results from your first session to the end result you want to obtain. In average, you propose 4 to 5 sessions. If you only do one session, a peeling will have more bring radiancy or a flash effect to the skin. But if you want really to work on the anti-aging, we prefer to propose 4 to 5 sessions. In 3 to 4 sessions, you will have already nice results. In between the sessions for the anti-aging, you will leave like 3 weeks to 1 month in between, as you're working on skin renewal, on activity of the fibroblasts that you want to stimulate. So that is the perfect schedule. The first step is the cleansing of the skin. You have the cleansing milk. A woman normally we cleanse twice to remove any remaining makeup. A man in one cleaning session is sufficient. After cleansing, you can dry the skin, and you will use Kleenex with this. During the cleansing, you analyze the skin, you see if there is no, if all the imperfections and makeup is gone, and also if there is no contraindication that you should need to notice at that moment. Dry always at the back side of the ears also, because sometimes it's staying wet otherwise. The skin will be prepared by the pre-peel. For the peeling, it is to degrease the skin. You take 2 cotton pads that you will soak with the pre-peel. Don't do it in the direction of the patient, do it backward. Make sure the cotton pads are well soaked. I normally use 2 cotton pads in order to make a symmetry during the treatment. When you go over the skin, you can have a slight redness appearing. It's normal. And when you go under the nose, it's better to inform the patient that it can take a little bit on the breath, because it's alcohol based. Do 2 passes. You go everywhere. To protect more delicate zones, or eventually, so it is the nose, it's the lip, even eventually tattoo, you will use the comfort cream. So I will show you, if the person has some permanent tattoo, you will better protect also these zones, like this, to avoid any discussion with your patient if the tattoo is getting lighter over time. In order to protect the eyes, we will put a cotton pad that is divided in 2. You can make it a little bit wet, so it will remain easier on its place, and then you can apply it during the treatment to avoid any possibility to hurt the eyes. We decided to take the 20% peeling. You take off the lid, and you apply the peeling with a swab. Open the bottle, you can put the swab inside of the peeling, take off on the side the remaining of the excessive product, and then you can begin with the peeling. You will divide the face in cosmetic units, so you have the forehead, the nose, the chin, and the cheeks, the neck and the décolleté. And we started peeling always with the more thicker skins zones, so you have the forehead, nose, chin is 1, 2, 3. Then you go to the cheeks, the neck and the décolleté, and ending in the décolleté. For this peeling of Contrage GLYC-EXFO, we will apply 2 layers, and a vertical one, a horizontal one, so you have a very nice overlap. I normally start in the center, and I use slight straight strokes. Always notice where you have been. You see also the the peeling a little bit like wet onto the skin, so you can follow what you're doing. I use also a lot my fingers to follow the place where I have been, because sometimes you can be distracted. On the nose you can do a little bit more layers because it's a thicker skin, and then you can do also the chin. Start always from the inner part of the face to the outer part. It's easier to apply. For the cheek, you turn a little bit the head, and you go from the place where you stopped, you go to the ears. So for the other side, you slide a little bit, you slide like this, and you go downwards. Then you can go to the neck, also 2 layers. And the décolleté. So horizontal and vertical. From this point, then you will put your 3 minutes onto your mobile, and you leave the peeling during 3 minutes onto the skin, and you monitor the skin meanwhile. So what do you feel from pain? If 0 is no pain and 10 is heavy, a burning sensation, what is the feeling for you?
3.
Okay, that's very nice. So as normally the peeling will have between 2.5 and 5, and we see also that we have a nice end point with the slight redness and tightening of the skin. The peeling can be neutralized with the peel neutralizer, so we also will apply it with the cotton pads. In the same way that we apply the pre-peel, we can do the neutralizer. So that's one way. I will show you afterwards another way or another method. So normally in the glycolic acid peelings, the sensation of burning will disappear directly or very quickly after neutralization. So you do the neutralization quickly and steadily, and you don't forget any place where you have put the peeling. So always be very concentrated during your peeling treatment. You can pass twice over every zone. At the same time, you can already remove the cream that you had put. So this is one way we can neutralize. If we have a man or we want to neutralize quicker, then the method that we would use is applying a sufficient amount of neutralizer in the hands and do an effleurage or a slight massage. Slight movements, no pressure. And this is also the kind of method that you should use when you have a man with a beard, because then you're sure you can neutralize in the beard zone. Now we have neutralized the peeling, so the burning effects will be gone. And I have prepared cold water to rinse the cold water will refresh the skin, recomfort it, and you can leave it some seconds for the patient's comfort. You rinse it twice. The advantage of rinsing with cold water will also give you the security that you have diluted any remaining peeling, and that when the patients go home and has some burning effects, still remaining post-peeling or this possibility, it is not because there is any peeling left. Then we will dry the skin also. After neutralizing the peeling, the patient will have quasi no burning sensation anymore. Then we will rinse the skin with cold water. This will give a reconforting effect, and it will also lower down any remaining sensation of itching or irritation. The advantage of using the method to rinse and rinse twice is that any possible remaining peeling acid will be diluted, and that you are sure that the patient goes home with no guilt anymore. After rinsing, you will dry the skin, and then you have two options. You can use a mask post-peeling if you are doing an anti-aging treatment and you want to give hyaluronic acid into the skin, or you can also finish the peeling with a LED therapy, or using the comfort cream as a barrier cream to do the final step. Here also, don't forget behind the ears that everything is well. The next step is applying a mask. You will apply the mask under occlusion. You have a cellulosic mask with one side that is a brilliant side, and is this side that you will apply onto the skin. You can use two kinds of actives. We have the hyaluronic acids mask that comes in a syringe that you will apply with a brush, and we have also the vitamin C. Post peeling, we suggest you will use the hyaluronic acid mask, as the vitamin C is really strong and can have more burning effect. So this will be much more comfortable for the patient. So you can easily turn the quantity of product you want. Normally you use like 5 to 6 ml a mask, and then we put it in a jar, and you can apply it with a fan brush, or you can apply it with a mask brush. It is the different options. You give one layer on the skin, then you apply the mask, and then you add a second layer on top so that the mask is well impregnated. Adjust the mask onto the face. And you can apply the second layer. This mask will remain 10 minutes onto the skin. So we have applied a hyaluronic acid mask with a cellulosic sheet. It is semi-permeable. You apply it with the fan brush and you leave it on like 10 minutes. Make sure that the whole face is well impregnated of products and that also the mask is very good adhering to the skin like a second skin. So after leaving the mask on for 10 minutes, you will remove it. First, delicately take the mask at the edges, and then you can easily take it off in one movement from the chin to the forehead. You have then two options. You can rinse the face if you want, but you can also leave the active ingredient here, hyaluronic, onto the face, but you need then slightly to do a massage to be sure that all the product is well impregnated. Before that you will seal the skin with the comfort cream. So here we have already a lot of product that has been absorbed. And if you don't wait that the product is completely absorbed by the skin, applying the comfort cream will glide too much. So now it's fine. This is the comfort cream that you apply post-peeling. The patient will use this 3 days post-peeling and then she can go back to her normal skincare regime. It is a barrier cream that will avoid water loss and dehydration of the skin and help the recovering or healing of the skin. You better warm it a little bit up and on the fingertips before applying it. And then with slight massage, bring it inside of the skin. As the name is telling, it's really recomforting and helping the skin to recover. Here the skin has already absorbed a lot of the hyaluronic acid, so it's really